I can't express enough my level of concern at these rising numbers of cases. We have 633 locally acquired cases of COVID in the community. As the Premier has indicated, every person is passing on the virus to more than one person, so we are continuing to see case numbers increase. Whilst vaccination will be an aid and essential for us getting to a point where we can live safely with COVID, our vaccination coverage at the moment is far too low. We need to push that up as much as we can. But in the meantime, we also need to do everything we can to not come in contact with anyone, to minimise our movements and to continue to get tested and isolate if you have the most minimal of symptoms. We currently have 462 COVID cases admitted to hospital and 77 people in intensive care, 25 of those whom require ventilation. We have people in their teens, in their 20s, in their 30s, in their 40s, in their 50s, in their 60s, in their 70s and in their 80s. And we know that for every one of those individuals in ICU, particularly those in the older age groups, they have a real and material risk of death. We will see more admissions and more deaths if these numbers continue to increase. We have a collective responsibility to do all we can to stop seeing those deaths and hospitalisations continue to increase. Again, I'd like to pass my condolences on to the families of those who have lost their loved ones, and again reinforce that we are seeing very high rates in suburbs such as Marylands, Guildford, Auburn, Greenacre, Yagoona, St Mary's and Strathfield. Please be cautious wherever you are in the state, but a particular call out to those suburbs. In Western New South Wales, there have been 23 new cases of COVID reported to 8 p.m. last night, and this brings the total case numbers to around 139. There's been a case in Burke. Also, people in the affected area through Western New South Wales and New South Wales more broadly need to be vigilant if they've been in Wilcannia in recent days, because we think that there's been some exposure in Wilcannia. New South Wales Health's ongoing sewage surveillance program has detected fragments in Bathurst and Orange, and again we need those communities to be vigilant and come out for testing. And also overnight we've had a detection in the Yamba sewage treatment plant. So again, that we ask that the communities be particularly vigilant. So in conclusion, can I just urge the community to follow the public health rules? Don't try and look for loopholes. You know the intent. Please minimise your movements. Stay at home. We can get through this, and I'm very confident with all the efforts in place that we can, but we need everyone to play their part.